forward. Last week, Vice President Pence recognized Missouri's use of the Google Marketplace during the White House COVID-19 briefing. And just this morning, Rear Admiral John Pulachek, leader of the Coronavirus Supply Chain Stabilization Task Force, called to learn more about Missouri's PPE marketplace as a potential best practice for other states. Again, I want Missourians to feel safe and confident to re-engage in the economy and social activity. We are exactly where we need to be with our 4 pillars to reopen, and I am thankful for my administration, our many partners and stakeholders across the state, and all Missourians for helping us to get to this point. With that said, we have a few other directors that are here today to talk more about their departments as we move forward to reopen Missouri. We know there will be lots of questions and concerns regarding unemployment. So first, I will turn it over to Director Hugh for an update on the Department of Labor. Director Hugh.
Thank you, Governor. Good afternoon. From March 15th through the week ending April 18th, we at the Department of Labor and Industrial Relations have served Missourians by processing over 400,000 initial claims for unemployment benefits, and also made close to $500 million of payments to eligible claimants, both in regular benefits as well as the federal supplement of $600. Last week, Missouri was one of the first states in the nation to process pandemic unemployment assistance program claims. Not only did we take the claims in, but we've already processed and paid thousands of eligible claimants a PUA weekly benefit, as well as the $600 federal supplement. This was accomplished while setting up remote work for over 2/3 of our agency, training over 100 additional state staff from our Department of Labor, as well as other state agencies to support the unemployment program, as well as contracting and training third-party vendor staff and preparing to hire 50 to 100 more temporary staff for additional support. Just to provide you with some context, normally at this time of year, we process about 2,300 to 3,000 unemployment initial claims a week. In the last 5 weeks, we've had 2 historically high weeks where we have processed well over 100,000 initial unemployment claims. We continue to prioritize the phone lines for individuals who have difficulties accessing our online resources. Our efforts to be responsive to the thousands of calls we're receiving will continue to direct callers to specific messaging for program information and updates. If you're calling about an issue on your specific claim, we continue to ask for your patience and understanding as we do our best to get to as many callers as possible. If you're on hold and offered the callback function, this selection will keep your spot in line, and the system will call you back when it is your turn. So please select that option if you want to be called back. You do not have to remain on hold. For members of the public who have access to the internet, please continue to do these things. First, log into uinteract.labor.mo.gov for the latest status of your claim and weekly payment. If your claim status is protest pending period, if no eligibility issues come up during that time frame, the payment will begin processing after the 10-day protest period. The second is resetting your own password by answering the security questions online that you selected when you registered for your uInteract account. Please try that first before calling. With each of our calls that we're taking, we have codes that our agents indicate what the call was about and why or what was resolved during that call. And so from those codes, we know that those are the top 2 questions that are asked that can be dealt with online. In addition, just a reminder, child support payments, existing non-fraud overpayments, and taxes for those who have selected to have taxes withheld reduces both the $600 payment as well as any weekly unemployment claims. Claimants are also reminded to take extreme care to provide accurate information when you're entering it online. Typos, wrong dates, incorrect answers to questions, and other data entry errors during the initial claims process will cause delays for eligible claimants. And again, more than 90% of Missouri's unemployment claims have been filed online and without any assistance from the department. It's all on our uinteract.labor.mo.gov website, and we continue to implement more options there to assist claimants with their questions. A few clarifications about the federal unemployment programs. Anyone who is self-employed and who wishes to file for Pandemic Unemployment Assistance, PUA, must first file for regular unemployment benefits and be determined ineligible. The step is necessary because PUA is a brand new program that the existing system was not designed to address. But once a self-employed claimant's information is in the system, they can file immediately for PUA, Pandemic Unemployment Assistance, if they fall into one of the 11 eligibility requirements. Some examples of those 11 categories include being sick with COVID-19, caring for someone in your household who is sick with COVID-19, and being the primary caregiver for school-age children when schools are having students stay at home. The full list of 11 categories can be found on DOLR's FAQ page, labor.mo.gov/coronavirus, under FAQ number 8. In addition, one of these categories must still exist at the time of your weekly request in order to receive payment for that week. While individuals can provide self-certification of the supporting category, the USDOL, and particularly its Office of Inspector General, have directed states to notify, remind, and enforce the policy that misrepresentation for the purposes of obtaining any kind of unemployment benefit is considered fraud and will be subject to prosecution, penalties, and repayment. USDOL has made it clear that general fear of COVID-19 will not support of unemployment benefits under both the regular unemployment insurance program and the PUA program. Therefore, if an employer provides the employee suitable work to return and the employee chooses not to return to work, then unemployment benefits will cease. If an individual files for PUA, it no longer falls under one of the 11 eligibility criteria under the CARES Act, then the individual cannot file for weekly benefits under PUA. In terms of guidance about workplace safety, the Show Me Strong Recovery Plan page has the April 27th DHSS health order with details about distancing, as well as the CDC guidelines for workplace physical distancing, in addition to information we have on our labor webpage and in the FAQs. In addition, local stay-at-home orders have included criteria for essential businesses and their operations, and those would still guide local business in the recall of employees to work. The Department of Labor is also working on a portal for employers to submit information on employees who refuse to return to work. We'll be announcing that shortly in terms of when the portal will be live and instructions on how employers can use that. And finally, the Federal Pandemic Emergency Unemployment Compensation Program, PEUC, is scheduled to be operational tomorrow morning, Thursday, April 30th. The program provides up to an additional 13 weeks of benefits for individuals who have already exhausted their unemployment claims. If they were already filing a weekly request for payment, they should continue to do so. All individuals who have previously exhausted their benefits in the past year will be notified by email or mail with instructions on how to log back into uInteract and to file under PEUC. That communication will be dependent on what the individual had selected when they registered their account. However, there's no need for individuals to wait for receipt of that communication. They can come back and log into uInteract tomorrow morning and look into the correspondence folder for instructions on how to file. Thank you very much. That's my update for today.
Anna, thank you very much. Thank you for what you and your team are doing. Needless to say, this has never been happened before, and I'm not here to make excuses for anyone, but I can tell you one thing. I talk to governors all across the United States on a weekly basis. most all of the states' unemployment systems went down within the first few days of what took place, and I'm so proud of our director and what that's been able to do to provide those services. We still got work to do. We know there's people on hold for long periods of time, but we're working on that every day to make it better. And we will continue to do that to make sure that people get those unemployment checks as soon as we can get them to them. So again, I want to thank the director and her team for what they've been doing. Also, a lot of questions are going to be coming up about the state parks. One of the things that we're really wanting people to do is get out, get active, and there's not a better place to do it than our state parks here in Missouri. And today, Director Comer is here with us to give us an update on the state parks in the future. Director?
Good afternoon. While the vast majority of Missouri's state parks and historic sites have remained open for day use throughout the entire COVID-19 crisis, the Department of Natural Resources implemented a number of measures designed to protect our visitors and team members. Those measures included canceling our tours and programs, closing visitor centers and playgrounds, and suspending camping and overnight lodging. Today, however, thanks to the governor's leadership, I'm here to announce a phased approach to resuming normal operations at Missouri state parks. This approach will help ensure visitors can enjoy Missouri's natural and cultural resources, minimizing overcrowding at Missouri state parks and historic sites. In addition, this approach will allow our state parks team the time to restore necessary services and prepare measures designed to allow proper physical distancing. Between May 4th and May 15th, lodging, dining, marinas, and retail stores operated by our concessionaires will reopen. Services and locations will continue to be limited, so we encourage you to visit our website for further information on each individual park site. On May 11th, Castlewood State Park, Elephant Rock State Park, Watkins Woolen Mill, and Weston Bend State Park will reopen for day use only. Parking will be strictly limited, and some trails may be closed to ensure proper social distancing is maintained. On May 18th, the off-road vehicle riding area at St. Joe State Park will reopen with a limited number of one-day permits available. Permits must be purchased online and in advance. Park campgrounds, and our more primitive park-run lodging will continue to be suspended through May 18th. At that time, we will evaluate when to reopen those facilities based on the available health information. Similarly, visitor centers, tours, programs, enclosed shelters, playgrounds, pools, and beaches remain closed as we monitor the initial stages taken to resume operations. We ask the patience of our guests as we balance providing recreational opportunities with maintaining a safe environment for our visitors and staff. As you head to a park, I encourage you to check moststateparks.com for individual park advisories and the latest actions in response to the COVID-19. We will continue to monitor crowds and visitation closely in order to prevent overcrowding. If a park is nearing capacity, gates or parking lots may close temporarily. If you're planning to visit a state park, we encourage you to choose a park close to your home. And as always, whether you're inside or outside, I can't express enough the importance of following the guidance provided by CDC and Governor Parson. Keep 6 feet between you and others, avoid crowded areas and groups of people, stay close to home and travel only with those in your household, wash your hands often, come prepared, carry hand sanitizers, wipes, and water, wash your hands often, share the trail and warn other trail users of your presence as you pass, avoid touching your face, avoid handshakes or hugs, cover your mouth and nose with your elbow when you cough or sneeze, pack out what you brought in, be kind and considerate of others, and most importantly, please stay home if you're sick. While safety, outdoor recreation, and service to our visitors are all very important to us, the safety of our guests and our team members remain our top priority. Thank you.
Thank you, Carol. Thank you for what you're doing with the state parks. Let me just remind everybody, we want to open up the state parks. We're really proud of them here in this state, that we get to showcase them, and it's a great place to take the families and for activities outdoors. But again, I will stress that we are in phase 1 of what we're doing, and social distancing is a key to it. So I ask you to abide by the rules when you go there. We want to keep them open. but it's going to take all of us to take that self-responsibility to make sure that you do take that upon yourselves to abide by the rules so we can keep them open for everybody. I think there's going to be an opportunity this year for our entire state to be able to showcase our state a little bit more, because I'm not sure how many people are going to be wanting to travel outside the state. So it'll be a great opportunity to visit some sites here in the state and help our small business, local businesses across the state. So again, thank you, Director Comer, for what you do and your department does. As we move into the recovery phase of COVID-19, we must continue to prioritize not only the physical health of Missouri, but also mental health. And today, Director Stringer is here to give us an update on the Department of Mental Health. Director Stringer?
Thank you, Governor. First of all, I want to express my sincere sympathy to the Missouri families that have lost loved ones to this virus. Please know that you'll remain in our thoughts and in our prayers. Second, I want to thank the many Department of Mental Health staff at all levels and in all settings that have performed spectacularly during this crisis, including the dedicated men and women who work in our state psychiatric hospitals, rehabilitation centers, and state-operated community programs. I cannot tell you how much we appreciate your ongoing commitment to serving some of the state's most vulnerable citizens, especially during this very difficult time. I also want to acknowledge my department's contracted community providers of treatment, prevention, recovery, and rehabilitation services. They are working hard to serve Missourians with substantial challenges, while at the same time dealing with their own challenges in terms of staffing, lost revenue, and extraordinary expenses for things like PPE. Let me give you some examples of the work they're doing in our communities. The state's community mental health centers and substance use treatment providers serve over 130,000 people each year. When the COVID crisis started, the entire community system pivoted in a matter of days to a virtual telehealth model of care to help individuals and their families dealing with those conditions stay safe, stay well in their homes, and importantly, out of the hospital. In addition to caring for their own patients and clients, they're also providing mental health services to frontline workers in other parts of the healthcare system, helping them with virtual services and special phone lines. I was particularly glad to learn that because we're all concerned about our frontline healthcare workers. In the world of developmental disability services, our providers support over 15,000 people in the community in a variety of settings. Because of that support, our individuals have an opportunity to lead meaningful, productive lives outside of institutions. We've heard stories statewide of direct care staff who left their homes and families to temporarily move in with the individuals that they support in order to reduce the number of people in and out of the homes and protect their individuals from exposure. Many of our providers have invested in computers and tablets to keep people connected with families during this time when they can't be together. And they're working hard to move people with developmental disabilities out of long-term hospital stays and into appropriate community settings in order to alleviate stress on the healthcare system. And Governor, our providers specifically asked me to thank you, Director Richardson, and other of my colleagues on the cabinet for moving so quickly with steps that allowed them to continue serving their communities and keeping their people safe during this crisis. Now, to all Missourians, many people who will be returning to work next week will understandably be nervous about it. There's nothing wrong with that. But I can assure you that proper precautions and common sense make a huge difference in how and where the virus appears. Let me give you just one example. Long-standing community providers with 70,000 mental health and physical health patients across the state, along with 2,700 staff, has not had one death due to COVID-19 and is unaware of even a single hospitalization. An important reason for that is that the first action in every clinical visit since mid-March has been COVID screening, education, and prevention. Finally, for those of you who may have trouble coping with anxiety about returning to work, I want to mention once again the Federal Disaster Distress Helpline, which was created for times like this. It's staffed with health professionals who can talk with you, and if you need more help than they can provide, connect you with services right here in Missouri. Their services are free and confidential. The Disaster Distress Helpline has a website which is easily found with a search engine like Google, or you can call 800-985-5559, 800 985-5990. Thank you.
Mark, thank you for what you're doing, what you have done, and what you will do. And I want to especially thank those employees. It's remarkable what the state employees have done during this time to go to work every day in tough situations, whether correction officers, was mental health, was public safety, was Department of Labor, almost all the departments. But the people in the mental health situations, the people that were willing to come to work every day and take care of people that can't take care of themselves, and understand that's a job most people don't want to do. My hat's off to those people for doing what they've done, for sacrificing for others, putting their care of those individuals before themselves and their own family in some cases. So I really appreciate what they did. So many people stepped up. As we get closer to Monday, Missourians may be feeling many different emotions. Some people are excited. Others are nervous and unsure. No matter what you're feeling, I want to assure you that we have prepared for this, and we will continue to do everything we can to keep Missourians safe. However, I will say this again, COVID-19 is still out there. And at the end of the day, it comes down to looking out for each other and taking responsibility for our own actions. For our recovery plan to succeed, we must all continue to be proactive while adapting to these new challenges. Use common sense, social distance, protect yourself and the others around you. If we can do this, we will be successful. Thank you, and God bless. I have the directors back here. Director Carson's back here, and Director Williams is back here if you have questions for them. The one thing I would ask, there are several directors here today, if we can bring them up, if you can all ask your questions towards each director, we would appreciate that very much. So the time's yours.
Governor, can you hear me okay?
Yes.
Do you anticipate daily reports of new COVID-19 cases to increase after your order lifts? And if they do increase, will you take responsibility for that?
Well, let me go back to what I've said all along. I don't think you can look at it on a daily basis. I keep saying that over and over. But the reality of it is, because you have a one spike day on those, that could be simply a lab, dumping that material in, and we've talked about that many times. If we see a trend that we're all of a sudden we're escalating back up, we're going to reevaluate the situation. It's that simple. But right now, I think we have the tools into place. I'm confident that we're on a downward spiral for the majority of the state, and I believe St. Louis is at that plateau for better terms, looking over the edge, and it's remarkable what they've done. So we're going to be ready for that. We'll be watching all the data every day like I have been for months now.
This deals more with unemployment, so this might be directed toward the director here. But how many people of those 400,000 are still waiting right now? Do we have a number on that? And for the people who can potentially return to work on Monday, I know this was briefly mentioned, but who may be afraid to return to work, are they still able to collect employment benefits?
I will let the director come up there and answer that too, but my understanding is if your boss calls you and tells you to come back to work, you got to fulfill that requirement if you want to go back to work, but you'll have to go back. But I'll let the director answer also.
In terms of the numbers for individuals who are yet been paid, we process claims every single day. So there are going to be people in a variety of different categories who will not have been in paid status yet. Generally, under regular unemployment insurance, you have the 10-day protest period, and after that protest period is done, if there's nothing that's found during that time to deem you ineligible, your payment will be paid shortly after that, within a few days. However, for regular pandemic unemployment assistance, the new program that we have up, there is no downtime in that. Claims that were processed last week and deemed eligible actually got payments last week. And so, again, we are processing those as close as possible in terms of the timing of it, but generally it takes at least 10 days for regular unemployment protest period, and again, that's because the employers are the ones who pay that unemployment insurance, and under the law, we are required to give them that time. It's part of the due process for unemployment benefits.
So as far as for places like restaurants that are opening up next week, if they're maybe not doing a full capacity, but their employees, their servers, bartenders are able to come back but have limited hours, are they able to get any sort of help through employment, or is unemployment then kind of a moot point since they're back into work?
They can continue to file, and part of the question for the weekly benefit is how much have you earned that week? So it is literally what have you earned in the past week. And so, you have to have earned above, I think, 384 currently in terms of complete disqualification for a weekly benefit. But so for those individuals who continue to have diminished hours in their work, there will still be the ability to continue to file, and then your weekly earnings will have some level of impact in terms of your eligibility for continued benefits.
Director, this may also actually be for Dr. Carson as well for law enforcement, but for employers, have you given any thought to guidance for employers on employees who may want to be still wearing masks many months from now, no matter what the status of the pandemic is? People who work in hospitality, for example, industries, employers may want people to be showing their faces to customers more, but do you have guidance on that going forward?
We currently don't have any guidance on that. And again, I think we would follow the Department of Public Health and Senior Services in terms of their guidance, and then as well as CDC in terms of that. For any issues related to workplace safety, the Department of Labor, U.S. Department of Labor has a number of resources out there, both for businesses and employees and workers out there related to workplace safety and guidance there as well. Okay.
Any other questions for Director Hughes? I know that it's hard to put a figure on how many people have actually started receiving benefits, but of the 400,000, do you have any ballpark percentages of how many people have actually gotten a check?
Well over 76% of people have gotten a check. So either their full payment, or if there was a partial payment, they're under the Pandemic Employment Assistance Program, we're just awaiting documentation from them to be able to provide them more than the $133 minimum per week under that new program.
So of the 400,000, 76% of them have received at least one payment?
Correct. We paid over $500 million in claims so far since March 15th, both in regular unemployment benefits as well as federal benefits. Okay.
I have a question about the numbers. I know the unemployment claims usually come out on Thursdays, but do you have any, are you seeing any trend for what we can expect to see tomorrow, or are you seeing claims going down as the pandemic is, as the state's starting to reopen?
Again, those numbers are a week out, so they're lagging numbers. And so tomorrow morning at 8:30 Eastern Time, 7:30 here, Missouri, Missouri's numbers will come out with the national numbers, weekly claims, initial claims. And again, we've had historically high numbers. So the previous week, we were at 59,000, but the week before that, I believe we were at over 100,000. And the week before that, it was 91,000. And the week before that, it was over 100,000. So, clearly there are no immediate trends because it's a lagging indicator. We can't really see the sort of effect any sort of reopening would have for probably at least 2 weeks in terms of the weekly initial claim data.
Any questions for Director? I have one. Hi, Director.
Hello, how are you?
Fine. So you said that parks would gradually reopen between May 4th and May 15th, right?
Park lodging, yes.
Park lodging. Do you know when overnight camping will be reinstated?
That's part of our second phase of reopening. Right now, we are looking at, because lodging is different, it's confined spaces like a hotel room with individual bathrooms. Camping is very different than that, as are the more primitive cabins. So that'll be part of the second phase of our reopening here. I can't get evaluating that on May 18th, looking at the data then and then determining what that date will be.
So camping is still suspended under the first phase?
That is correct.
Okay.
Thank you. Okay. Thank you.
Director, I know this is probably taking a little bit of a back burner on your agenda, but as far as medical marijuana goes right now in the middle of the coronavirus pandemic, where is that plan and that rollout?
I answered this in an interview. It's probably taken a millionth of my time that I've thought about that during this. But I do have a team that is doing that. And so they start after May 4th, going out and doing their own site inspections. I'm told that they will be on target to have at the dispensaries medical marijuana in midsummer, which they define as late July, early August.
Today there was a temporary restraining order filed by, I know, the Sarkozy Nursery dispensary, I guess, organization, as well as a few other people who did not get cultivation, other facility licenses. That lawsuit mentions you and the department. Do you have any response to that lawsuit or that restraining?
Not abide by the St. Louis County structure in terms of stay-at-home orders, but instead move forward on May 4th with the statewide plan. Do you have any reaction to local cities deciding to go with the state as opposed to their own county?
I'm going to punt that one to the governor.
Good move, Director. On that, I think any time that we're talking about it, I want to go back to the whole structure of this. It falls back to the local levels. So with the state order in place, I would hope that most of them, as they change their orders, would line up with the state orders as much as they can when they decide to open up. So people do have some sort of normal view of how they should go to businesses and everything. So we hope people line up, and we think most of them are. If you're within a county, if you're within a city, within a county, and they've got that order in place, you're going to fall under that county rule. It's just simple. That's why we've always maintained that local mentality, that local control, so they know best. But it's no different to me as governor. Sometimes I have to look at the whole state, and I have to figure out, to make different decisions for different parts of the state, and that's what we've done. So, but again, that's a local issue.
Oh, my question is for Dr. Williams.
Unless it's a hard one, then it goes to the governor.
Okay, I think this one is for you. So the CDC director said about a week ago that the second wave of COVID-19 might be more devastating than this first one. What are you doing now to prepare for that potential second or even third wave of COVID-19?
Yeah, and Bob Redfield's a good friend. And so I think what he was saying was that we certainly, will have the flu next year in November. And so we really encourage people to get their flu shots next year. So we're going to want to make sure that we have that capacity and really push out that message. And then also, one could anticipate that with the reemergence based on past history of other viruses, when the winter comes around, that COVID-19 could possibly reemerge. And so, our motto has always been hope for the best, prepare for the worst. So what we're doing is using this time basically on the 4 pillars that the governor has talked about. And one is to have the capacity to do testing. We have a comprehensive state strategic testing that tests, as he said, in case of outbreaks. It's targeted at providers, since we know that 10 to 14% of cases are in providers. It gives us the capacity to do surveillance and monitoring. Director Carson will be spending that time to build up PPE. We will have a time to do that. We'll also be doing predictive analytics based on data we're getting now to see where we might see areas of outbreaks. And ones that come to mind right now are meat packing plants, long-term care facilities, with Director Stringer, the behavioral health and veterans homes. And then finally, as the governor has said, one of the things we look most closely at is hospitalizations. So we want to make sure that we have ventilatory support. We've been incredibly fortunate in Missouri. We never had to enter a crisis care type situation. And so we will be using that time to store up on our resources and making our plans. And we feel very good about that. Thank you.
Let me just add on to what Dr. Williams said on the question you asked and what's so important that I think I go back to the time frame when this all started just about 50 days ago. And at that point, we're all trying to figure out how to deal with this virus. No matter whether you was in the medical profession, whether you was in our seats that we sit in, or the directors who are up here today. And I think the one thing that we're all going to be is much more prepared if it does come back, if it's in the next fall. We're going to know how to handle that. We're going to know how to isolate a lot better. We're going to know how to target test around the state. We're going to know where the hospital shortages are. Plus, we're going to know somewhere where the virus has the potential to attack in different areas or different places than we did that 50 days ago. So I think we're going to be much more prepared for it at the time. I think all of us as a whole will be, and I think we as individuals, our family members are going to be much more aware of what it takes to fight this virus on that.
Governor, do you have any more of a sense on what the amount of the deficit is next year the legislators are working to address this week? I think it was $700 million you mentioned the other day, but I've seen different numbers out there. But can you just kind of clarify what that number is as far as you know? Well,
I think if you look at state numbers, it needs to be a real 700. Let me just say that. That's got to be an amount that we got to take a look at. So I would just suggest this as we move through the budget process, that we move through very cautiously. We make sure that we're doing, quote, a balanced budget if we're going to put one out there. I think that's important to keep that in mind as we move forward to this. As far as the revenue goes, this second quarter is going to be tough. So to build that budget, keep that in mind. Although I am still optimistic that third and fourth quarter things might pick up. The unknown, the real unknown too, between now and the end of June is what are the feds going to do? How much are they going to help? Are they going to help? And how do we prepare for that? But I think we have to prepare to make sure that we're not in a position in July the 1st and all of a sudden I'm in a situation where I got to withhold $600 to $700 million starting in July the 1st. We don't want to be in that situation. People should know what that scenario is going to look like and what to prepare for. So I think that's one thing we're really concerned about, making sure that it is a solid budget that comes in with numbers that really affect the state of Missouri.
Governor, Missourians are coming to the Capitol tomorrow to protest in the sense that you've done little for COVID and housing. They're saying that they'd like rent and mortgage suspension along with expanded services for people experiencing homelessness. Do you have any comment?
I think we've addressed these issues over the last 30 days with everything. The homeless, we've been working with the mayors around there. All the state resources have been available to help to assist on that. Again, for the people at home, whether it's the eviction portion of it, I think a lot of the cities have taken steps forward to that. And again, I think those are actions, some of those actions that have to be taken by the courts. The utilities, we work with utility companies early on. We've announced that several times here that most of them have agreed not to suspend anybody's utilities at this point. But I think you also got to remember that sometimes there's things not under control of the government or the PSC, that you have private entities out there, whether it be the city utilities, municipal leagues, and things like that we don't have control over. But for the most part, I think we've been concerned about that the whole time. We're putting all the resources we have on the state level. I think you even look at the Medicaid rolls are increasing in the state. People are qualifying for that, and nobody loses those benefits at this point. And plus, it's now expanding simply because of the COVID-19 situation. All right, thanks everybody for being here today. Thank you.